Good evening, everyone. You are welcome to our maiden edition of this webinar that's focusing on diabetes. And the question is, what can you do about it? And to speak to us in this webinar today, it's our speaker, Dr. Omolara Olagunju, who is a physician, a member of the West African College of Physicians, and somebody that has special interest in lifestyle medicine and has taken care of many patients with diabetes. I want to advise that you do not just listen, but you have with you a jotter and a pen so that you can take down salient points that applies to your condition. And of course, at the end of the webinar, you will have the opportunity and privilege to ask questions. So I want to invite Dr. Molara Olagunju to give us the presentation. So Dr. Molara, over to you.
Thank you very much, moderator. Good evening, everyone. My name is Omolara Olagunju, as I've been introduced, and today we'll be talking about diabetes. What can you do about it? This is $1 million question that you should be able to answer by the end of this presentation. We'll be going through this outline. What is diabetes? What are the types and classifications of diabetes? The causes and risk factors, the symptoms of diabetes, what complications happen when one has diabetes, how do you manage diabetes, and living with diabetes, how do you go about it? Then eventually we'll talk about how to prevent diabetes. So what is diabetes? I'm sure you've heard a whole lot about diabetes, probably true, probably not true, but today we'll dissect this disease state. So if I want to go simple, I'll say that diabetes is a chronic disease which occurs when the pancreas, which is an organ in your body, does not produce enough insulin, or when the body cannot effectively use the insulin that has been produced by this organ. And of course, this eventually leads to increased concentrations of glucose, which can also be called sugar in the blood. So this is something that I'm sure you've heard over and over again, but we're going to talk about it today again. So diabetes, if I want to go professional, I'll say that diabetes is a chronic progressive metabolic disorder, which is characterized by hyperglycemia, mainly due to absence of the insulin secretion as in type 1 diabetes, or peripheral insulin resistance as in type 2 diabetes. And this disorder does not just restrict itself to carbohydrates, but also affects proteins and fat food items that have been ingested. And this causes a whole lot of complications and even death globally. So it is not something just in your locality. Now, what is the normal body digestion and absorption? How does it happen? When food is ingested, it is broken down into little molecules that can be absorbed by your body that would eventually give you energy. And we can see from this diagram here that a loaf of bread and apple has been eaten by this person, which is broken down, and insulin comes from the pancreas, and this insulin helps the broken down food to enter into the cell, which eventually gives you the energy that you require when you eat. So that's what happens to the food that you eat. And in diabetes, it is this process that is usually affected. So whenever anybody has diabetes, this usually is what happens. And it is a chronic, complex disease whose management requires comprehensive care. It's not something you can do once and for all. It's something that keeps taking your attention, and you keep having to go to the doctor, you keep having to stay and do what you're supposed to do when you ought to do it. It's something that causes a lot of complications and death. And don't think that diabetes impacts only the patient. It is not just the patient that is affected, the patients and their families. It also causes a lot of personal, economic, and psychological burden. We will see as we go on that diabetes causes a lot of psychological burden on people. It has a lot of effects on the heart and all other organs of the body, and it eventually affects the whole country. And at the moment, Nigeria has an 8 to 10% prevalence of diabetes. What does this mean? It means if you catch 10 people, at least one person will have diabetes, and many others might just be brewing the disease. This picture shows an iceberg, and we can see that 26 million people have full-blown disease. However, 79 million people, 2 times much more than the people that have the full-blown disease, are already brewing the disease, and they just might not know. And that is why we are having this sensitization today, so that you will know exactly what you can do about it. It is not something that you should play with. And right now we'll talk about the types and classifications of diabetes. But before we do that, we're going to have a poll. And this poll, we're just going to ask you if you think you have diabetes. And we are going to drop your answer, a yes or a no. I'll give you 15 seconds to do that while we wait. Okay, thank you very much for taking that poll. Right now, we'll talk about the types of diabetes. So we have many types. The disease presents itself in many ways. The first one is the type 1 diabetes. We have the type 2 diabetes. We have gestational diabetes, which happens in women when they get pregnant. This woman might not have had diabetes before getting pregnant. However, upon getting pregnant, she develops this disease. And after delivery, she might even not have it any longer, but it predisposes her to having this disease afterwards. There's also latent autoimmune diabetes of aging. There's pre-diabetes, there's impaired glucose tolerance, and there's impaired fasting glucose. All of these are the ways in which diabetes can present itself. Now, for the sake of this webinar, we will focus our energy on type 1 and type 2 diabetes especially. So talking about type 1 diabetes, it's an autoimmune. By autoimmune, it means the body cells fight itself. And so when such things happen, the beta cells in the pancreas that actually produces this insulin are under siege, they are under attack, and so they are being destroyed, and eventually the pancreas cannot produce insulin as it ought. And such patients would always require insulin because they don't even have insulin at all for the absorption of food into the body. This disease, this type 1 diabetes, but is not as hereditary as type 2 diabetes, as we would see shortly. Type 2 diabetes has a 90 to 95% prevalence in patients who have diabetes. So we have many more people who have diabetes being type 2 diabetic patients. And in this type, we don't have loss of beta cells. Initially, what we have is insulin resistance, meaning that insulin is at the cells, at the level of the cells, ready to help you to absorb the glucose that you have been able to ingest. However, the cells are not recognizing this insulin, and because of that, there's a problem. This is a very, very strong hereditary disease. And the next picture shows us the difference between type 1 and type 2 diabetes. So let's talk about this first picture. In type 1 diabetes, there is no insulin. We can see that there's a cell here, and this is the door to the cell. Outside this cell, we have glucose, plenty of glucose all around it. But the key to open this door, which is insulin, is not available. So this person cannot make use of the glucose around it. So it is suffering in the midst of plenty. Type 2 diabetic patients, however, in their case, have the door, the cell is there, the key is there, but it's a wrong key. So even though everything seems normal, things are still not going the way they ought. I'm sure all of us have found ourselves in such situations whereby you are trying to open a door with the wrong key. The door wouldn't just open and you cannot gain access. So that's what happens in type 2 diabetes. What are the predisposing factors for diabetes? For type 1 diabetes, people who are 30 years and younger are more likely to develop type 1 diabetes. It is hereditary. can be autoimmune, I explained that earlier, and some viral infections can be associated with the development of type 1 diabetes. Viral infections like Epstein-Barr virus or even the flu virus, the Haemophilus influenza virus, all of these can be associated with the development of diabetes. For type 2 diabetes, the predisposing factors include older age, especially greater than 45 years, if one is overweight, if one has hypertension, if there is abnormal lipid levels when one goes to do a cholesterol level in the hospital, that is lipids. And at that point, the values can tell us a whole lot about your predisposition to diabetes. It's hereditary, races and ethnicity. There are some races that are associated with diabetes, like the African race or the Asians. They're associated with having diabetes, a history of anybody in your family that has diabetes, environmental factors, and even inactivity. All of these are associated with diabetes. Further risk factors that can be explained for type 2 diabetes. I want to go to town on this because this is what you and I can do something about. Being overweight. Now, if your body mass index is greater than or equals to 25 kilograms per meter squared, then you are at risk of developing diabetes. What do we mean by body mass index? It is something that is used to help us find out if you are overweight or underweight and your predisposition to having some cardiovascular diseases and some complications that are not good, like sudden heart attack. How do you calculate your body mass index? It's just your grams all over your height in meters, and you square that. And all of that you can do at the comfort of your homes. Now, someone who is 45 years and older stands a higher risk of developing diabetes, physical inactivity, and diabetes if it occurs in a first degree relative. Please make sure you go and check if there's a history of gestational diabetes or you've had a baby greater than 4 kilograms or 9 pounds, please ensure you check for diabetes. If your doctor has ever told you you have polycystic ovarian syndrome, then you stand a risk of developing diabetes. And if anybody has told you there's an impaired glucose tolerance or impaired fasting glucose state, then please check for diabetes. Furthermore, if your high density lipoprotein cholesterol is less than 35 milligrams per day, or the triglyceride level is greater than 250 milligrams per day. All of these values you can get when you go to the hospital and do a cholesterol test. All of this you can get when you do that. And if the values do not fall within the normal ranges, then you're at risk of developing diabetes. Race, ethnicity, I talked about that earlier on. If there's the presence of coronary artery disease and or hypertension, hypertension is almost everywhere, please go and check for diabetes. And even if there are blood vessel diseases, please go and check if you have diabetes. And all of these are quite important because there are things that we see almost every day. What are the clinical presentations of diabetes? Basically, diabetes can present in 3 ways, one of these 3 ways. It could either be asymptomatic. What do I mean by asymptomatic? This patient would come having no symptom at all of diabetes. It might just be picked up during a routine check. Or it could come up with symptoms. We would see that as we move on. Or the first presentation might be when this patient is coming down with the complication of the disease. And we don't want that to happen. That is why we are having this presentation today. So what are the symptoms of diabetes? Increased thirst. You just feel like taking lots of water. You take water and you just feel like taking it all over again. Increased hunger. Despite eating, you still feel like having food. Unexplained weight loss. You've eaten your normal quantities, but you're losing weight. You have dry mouth. There's headaches. You feel weak unexplainably. You have blurred vision, frequent urination, or even waking up at night to urinate, or you have urinary infections. All of these might just be symptoms of diabetes lurking around the corner. If you have wounds that would not heal, please go and check in the hospital for diabetes. Now, I said earlier on that diabetic might be asymptomatic, whereby there are no symptoms. You don't feel anything in the body. However, the disease is going on already. And it could also come as a life-threatening consequence or complication or even death, whereby for the complications, it could either be too much sugar or too low sugar. So you have to be very careful and ensure that you're checking as soon as you leave this webinar. What are the complications of diabetes? Diabetes is a disease that affects the whole body, so we call it a systemic disease. However, there are some key organs that bear the brunt of this disease on long term, and these organs include the eye, the kidney, and the nerves. And in the eye, it's called the retinopathy, whereby it results in loss of vision eventually. In the kidneys, we call it nephropathy, whereby the kidneys stops functioning well. And then in the nerves, we call it neuropathy, whereby you might even stop feeling at the tips of your fingers and on your foot, and this can be very, very distressing and very, very dangerous as well. Other complications include the gastrointestinal, which happens in your gut, the genitourinary, whereby patients have frequent urination or even erectile dysfunction, and cardiovascular symptoms as well. We can see that diabetes has a far-reaching consequence on the sufferers. And I hope you're not surprised to see that diabetes can cause depression as well. Please go and check if your blood sugar is high. Don't assume that all is well. At this point, I'm going to take the second poll, and this poll says, do you think you stand a risk of having diabetes? Just drop your answer, yes or no. I'll give 15 seconds for this. Thank you. Thank you very much. I'd like to believe that you've dropped your answers. So we've talked about diabetes, and I'm sure you like to know what values would even let me know if I have diabetes or not. Okay, so this table answers that question. If you do your fasting plasma dose, where you haven't eaten for 8 to 12 hours and your glucose is checked, and the value falls 100 milligrams per DL or below, then you're normal, you're within the normal range. However, if it falls 100 and 120 milligrams per DL, that is an impaired result, impaired fasting glucose result, and this person is already brewing diabetes. However, if it falls 120 milligrams per DL and above, the person has full-blown disease. And then if you do a glucose test 2 hours after you've had your meal and it is 140 milligrams per DL and below, then it's normal. If it falls between 140 and 200 milligrams per DL, that is called impaired glucose tolerance. And if it falls 200 milligrams per DL and above, that is full-blown diabetes. So you have these values to work with when next you go to check. So diabetes has no cure. However, it can be managed successfully if you cooperate with your healthcare giver. What are the ways of managing diabetes? There are a couple of things that can be done that all work in concert to get a good result. Health education, you can see, is first on my list. Health education and counseling. And this has to do a lot about your lifestyle modifications, changing the way you live. That's simple. Yes, it works. And self-monitoring. Talk about medications, use of drugs, and adherence to these drugs, or even insulin, as the case may be. Then management of complications, management of other related diseases that might come up as a result of this diabetes, or other things that you might have. Probably you're pregnant and you just want to check, and all of that. Referrals. The physician only cannot manage diabetes. We need everybody in the healthcare system, and so you might be referred from the people controlling your food to the people checked for complications on the food and all of that. And so you might be moved from one person to the other, and ultimately prevention of diabetes is part of management. So what are the key components of diabetes complication? One is your glucose control. because when the glucose is well controlled, the complications might not even come up at all. And then we talk about cardiovascular care, meaning we check the state of health of the heart and the vessels. Talk about your kidney care, your eye care, your foot care, neuropathies, oral care, emotional and sexual health care is also very, very important. All things we have to look into for successful management of diabetes. What are the goals of management? Let us catch it early as possible. And then prevention of short-term and long-term complications that might come up. Prevention of premature diabetes can cause death. And then promotion of self-care practices and empowerment of people living with diabetes. This is what we are doing right now. Reduction of personal, family, societal burden of diabetes, and all of that are things that we should look out for and goals we should have when managing diabetes. So health education now. So we are gradually getting to the meat of the matter. Education is critical. Work is half done. First thing I'll talk about is lifestyle modifications. We are going to go to town about this. As one, there's glucose monitoring, there's treatment modalities, pharmacological, which means your drugs, and non-pharmacological, which means other things you do that aid the successful management of this disease. Recognition of complications that might come up. Follow up. Make sure you don't miss your clinic visits, and ensure that your foot, your eye, your mouth, and every important part of your body is checked whenever you go for follow-up. So you could ask your healthcare provider. So healthy lifestyle, I like this part. Health promotion, this is very, very, very important. Immunization is the first thing I'm going to talk about. Now, immunization is not just for children. You are supposed to get immunized as well against Haemophilus influenza virus. Remember it earlier on, against herpes zoster virus, which can come up after, against human papilloma virus, which can cause cervical cancer, and tetanus toxoid disease. Regular checkup for early detection of disease. Avoid infections as much as possible. Keep your environment safe and tell others about this good information you're getting. The body mass index again. So I explained it briefly earlier on, and here we can see that the normal weight is when your body mass index falls between 18 and 24.9 kilograms per meter squared. Anything outside of that is overweight, and we can have it up onto morbid obesity, that is class 3 obesity, when it is greater than 40 kilograms per meter squared. All of these people stand the risk of developing diabetes. Now, what is this energy balance about? When you eat just what you need to expend during the day, you would not add weight. However, if you are eating less than you need to expend during the day, you will add weight. And you are eating more than you need to expend during the day, you will add too much weight. So please, it depends on where you fall. If you're on the overweight side, then you should reduce the calories you're taking so you can lose weight. And if you're too slim or you're underweight, then you should increase your calories. However, if your weight is just appropriate using the body mass index, then please maintain that good weight. Now let's talk about alcohol. Alcohol is not the friend of the diabetic patient. The American Heart Association says that it is safe for men to take about 21 international units of alcohol per week, and women 14 international units of alcohol per week. However, if it can be avoided, why not? You can do anything you have to do to stay healthy. Smoking is a total no for a diabetic patient. Please don't smoke. The risk of developing diabetes increases by 30 to 40% for anybody that smokes. And even if someone has diabetes already, there's a risk of drugs not working when you smoke. So smoking is not good for the diabetic patient. And let us watch out for passive smoking, otherwise called secondhand smoking. What do I mean by that? You are not the one smoking, but you stay in an environment where people smoke. Probably someone living close to you smokes. Please beware. You stand the same risk as the man that is smoking, if not more. So please avoid secondhand smoking as well. Now, exercise. This is very, very important, and this works so well. Now, what does exercise do to you? You've heard a whole lot about exercise. Exercise helps to increase the uptake of glucose by muscles, and it improves utilization. And then it helps you manage your cholesterol. It just goes well, and it's just well balanced in the body. If you exercise at least 30 minutes per day for at least 5 days in a week, that is just appropriate, and that is just good enough. And then you should consult your doctor before you commence on any exercise modality. Please check your blood sugar before, during, and after exercising so you don't run the risk of too low sugar. Now, when should you stop exercising? Yes, exercise is good for you, but you have to watch out for some very important things while exercising. If you are exercising and you start to have chest pain or chest tightness, please stop immediately. If you develop difficulty in breathing, if you become dizzy or become lightheaded, if there's difficulty in finding your balance or you're staggering, or you feel like vomiting while you're exercising, please stop and see a doctor as soon as possible. Now, while exercising as well, avoid trauma to your feet, because for diabetic patients, we don't want them to have any wound on the foot because of the neuropathies that they have, the nerve complications that they have, whereby they stop feeling things, and then even if they step on things that hurt them, they wouldn't know. So wounds develop and they just don't know that things are going on. Avoid pounding activities that could cause vitreous hemorrhage. This is when little vessels in the eye rupture, very, very bad for the eyes. Caution coronary artery disease. If you are hypertensive or there's a history of myocardial infarction, please be very, very cautious. And then baseline stress tests may be indicated in some patients before they start exercising. So please, yes, it's good for you to exercise, but be careful while you do so. Now, dietary control. I like this part because it's all about garbage in, garbage out. Eating habits, let's start with that. So the choice of your food item is the first thing we're going to talk about. What are you eating? Is it junk or healthy food? The time that you eat, is it close to bedtime? How frequent do you eat? What is the style of eating? Do you hurry over eating your food? What are the portions you take? Your eating environment and the use of water. We don't want diabetic patients to have any infections. So I like this picture because it tells me how simply I can decide how much to eat. My hand tells me a whole lot. If I make a fist, that is just the size of the carbohydrates that I should take. And then if I open up my hands, the size of my palm is the size of the protein that I should take. And then my thumb or the tip of my finger can tell me about the fatty food items that I can take, and then a scoop or a cupped hand tells me about the amount of nuts I should take. This is just a rough guide for you to know how much food to take per day. So this picture shows this lady who is torn between two options. She doesn't know what to pick. Is it healthy eating or junk eating? I'm sure you can answer the question by now. So this is a lot about what to do. So this picture is just a description of your plate, and we can see how your plate has been divided. This is all about the fruits and fibers that you should take. We can see that it's taking a whole large chunk in your plate. The next is the other carbohydrates that you can take. We prefer that they are high fiber carbohydrates. And then we'll talk here about proteins. We can see the quantity here. Then we can see the quantity for dairy and this little quantity for fats and oil. You don't need much of them. So be careful what you eat. And then don't forget to take lots and lots of water, about 6 to 8 tons per day. This is just a sample menu for people living in my environment, whereby you can have breakfast, 2 slices of brown bread, and a teaspoon of butter with a cup of skimmed fresh milk. This is good for you. Lunch can be half cup of rice plus half cup of beans with 30 grams of fatless meat with vegetables and fresh fruits. Very good. At bedtime, you can have a slice of whole wheat or 2 pieces of crackers, a piece of bananas, or half cup of skins. Are examples of things you can take while you are diabetic. Now it talks about how to manage diabetes. We have, it's not just about the doctors. We have you here. The doctors and the nurses are here in the clinical services. You are here promoting your behavior, your good behavior, and then the government is here making policies. So what the doctors do is to help you with glycemic control, your BP control. They check your blood for cholesterol, they check your eyes, your foot, your kidneys, and all other important organs in the body. Where, however, you are doing a whole lot about creating awareness on physical activity, reducing tobacco, healthy eating, regular visits to your doctor is very important, self-monitoring and self-management. And the government helps us with policies that will help us keep healthy. So blood glucose monitoring, this is very, very important. You can measure your glucose and see how well you're doing. You have your hemoglobin A1C, otherwise called glycated hemoglobin. It should be less than 7%. Your preprandial, meaning before meals, your blood sugar before meals should fall between 80 and 130 milligram per dl, and your postprandial meals should be less than 180 milligrams per dl. There are a couple of guidelines you come across that have slight differences in the values that are given. So please don't be surprised if you see slight differences in these values. All are within the guidelines. And then avoidance of hypoglycemia. What is hypoglycemia? When your blood sugar goes too low. Yes, we don't want your blood sugar to be high, but we don't want it too low as well. And then we talk about individualizing the care, and then we have more stringent glucose monitoring values for people who have short-term diseases, and then less stringent for people who have long-term diseases. So let's talk briefly about hypoglycemia. What is hypoglycemia? It is caused by too much insulin or oral glucose reducing agents. That means those are diabetic drugs in the blood. So, or too little food or excessive physical activity. That's why I talked about checking your blood glucose before going for exercise. So when this happens, there's a surge in some hormones in your body, and you start to feel some things like sweating, tremors, tachycardia, palpitation, nervousness, and hunger. And then CNS effects, those are central nervous system effects affecting your brain now. There might be headaches, you feel lightheaded, you feel confused, there might be memory loss, slurred speech, incoordination, even seizures and death. All of these are complications of hypoglycemia. And then there's something we say neuropathies, which is nerve complications, whereby they do not have these symptoms. Sometimes all these symptoms are protective. They just let you know that, oh my God, this blood sugar is too low. However, some diabetic patients that have been diabetic for a long time do not have this awareness again. And so the next time you're seeing them, they're having fatal complications from diabetes. Please, if you have anybody that is diabetic, they must know about hypoglycemia. And if there is anything that looks like hypoglycemia, you feel jittery, you're sweating and all of that, immediately put 2 to 3 teaspoons of sugar or honey in your mouth, and then or 2 cubes of glucose, and then come to the hospital emergency room immediately. Now, how do you live with diabetes? You can live with diabetes successfully. What do you need to know if you have diabetes? The illness is serious. Yes, I'm sure from all that I've said so far, you can see that the illness is serious and it's not curable, but it can be managed successfully. The condition is essentially self-managed, and you have options. You can change your behavior, and that will go a whole long way in the successful management of diabetes. Self-care if faced with the illness. So the first thing is blood glucose monitoring. In fact, that is the first thing you would do for you to know if you have diabetes or not. You manage your weight, your food care, personal hygiene, exercise, healthy living, identify targets, your blood sugar targets, and then stop smoking. I mean, so many things that you can do. So who should be screened for diabetes? Any individual 45 years and above should have diabetes screening. However, if you are less than 45 years and there's a family history of diabetes, you should also be screened. And if you have a BMI greater than 25 kilograms per meter squared, you should also be screened for diabetes. And all other risk factors I mentioned, having gestational diabetes, having polycystic ovarian syndrome, hypertensive patients, please ensure you check for diabetes. Your cholesterols are not within normal limits, please check for diabetes. And then if you've not had any abnormal blood sugars, always check your blood sugar every 3 years. This will help you prevent diabetes and it's pouncing unknowingly on you. Now, additional risk factors for screening: physical inactivity, a first degree relative, if you've delivered a baby greater than 4 kilograms, or gestational diabetes, and women with PCOS, which is polycystic ovarian syndrome, hypertensive patients, if you have a glycated hemoglobin greater than 5.7%, or there's impaired glucose tolerance or impaired fasting glucose on previous testings, please go and check for diabetes. If your cholesterol levels are not within normal ranges, please check for diabetes. And the presence of some skin diseases might just be a pointer that there is diabetes somewhere. A lot of these happen, and if you have this on your nails, a discoloration, dysmorphic looking nail is not looking normal, please don't just pass it by. Don't think that it's just another thing. Please go and check your blood glucose. Also, if you have a rash on your skin, please go and check for diabetes. And if you have some discoloration and a patch on the skin as well, please go and check for diabetes. Don't just assume that all is well. Don't just think that there's no problem. Yes, go and check for diabetes. So how do you prevent diabetes? We have primary prevention. What do we mean by primary prevention? We don't want you to even develop it in the first place. That is primary prevention. So the steps you can take to prevent developing diabetes in the first place is primary prevention. What is secondary prevention? People that have diabetes already, and we don't want them to have complications. We want them to stay.
Yeah, the speaker has just had disconnection there, but she will soon be with us. Before she joins us again, I will just remind you that the speaker, Dr. Lagunju, has told us what diabetes is. She has told us the different types of diabetes, and she has focused on type 1 and type 2 diabetes. She has also told us about the risk factors for diabetes. She has told us about how we can prevent diabetes. She has focused on lifestyle, exercise, and diet. She has told us about how we can prevent complications. And she has told us about different complications, about complications in the eye, in the kidney, in the skin, in the nerves. And she has also told us about how we can measure our BMI, the body mass index, so that we will know whether we are at risk of diabetes or not. She has also told us about the importance of exercise. And she's just about telling us about how we can know whether we are having enough exercise or not. So she's asking us the question, how active are you? You can know how active you are if you count the number of active steps you take. You are said to be sedentary if you are taking less than 5,000 steps a day. You are said to be low active if you are taking between 5,000 to about 7,499 steps a day. You are also said to be somewhat active if you are taking steps between 7,500 to 9,999 a day. You are active if you are taking steps between 10,000 and 12,499 a day. And you are highly active if you are taking step that is more or equals to 12,500 a day. Also, you need to know that if you are active, then you'll be able to diabetes. How do you stay healthy? You stay healthy by observing the lifestyle modification that our speaker has been talking to us about. Eating a lot of fruits, drinking a lot of water, making sure that you do not eat junks, exercising yourself regularly, checking your weight to make sure it is within normal, and going to the hospital to have regular checkup. By so doing, you can stay healthy. Also, you can prevent diabetes. There are 3 ways of preventing diabetes. There's primary prevention, there's secondary prevention, and there's tertiary prevention. What is primary prevention of diabetes? You want to make sure if you have risk for diabetes, you do everything to prevent or delay the onset of diabetes. If you follow all the talk to you about, you are active by taking the right diet, by making sure that you exercise yourself and that you take a lot of fruits. By so doing, you can actually prevent or delay the onset of diabetes. Apart from the primary prevention, secondary prevention of diabetes. That is, you have been diagnosed to have diabetes, but you still control the diabetes. Is within that is secondary control. Tertiary control is you want to prevent complications of diabetes. You want to prevent complications of diabetes. That's tertiary prevention. Remember, our speaker told us that there can be complication in the eye, complication in the kidney, in the skin. You want to prevent that. Despite the fact that you have diabetes, when you are preventing complication, that is tertiary prevention. Also, for primary prevention, you need to eat a lot of fruits, exercise, make sure you avoid alcohol, avoid smoking, and make sure you live a normal, healthy life. There are lots of halves. Only about half of those to whom an intervention is appropriate will accept it. Like all of you that are listening to us now, if you have diabetes, or even if you don't have diabetes, you will discover that only about half will go forward and practice what we're talking about. It is also known that only about will follow what we're talking about, and only about half will also enjoy the benefits. The question is, where do you fall? I do hope that you will be part of those half that will not only listen, but we practice what our speaker has been talking to us about, and will prevent diabetes or delay the onset of diabetes. Our speaker is with us now, and she will continue from where I have stopped.
Thank you very much, moderator. So, in conclusion, I would like to say that access to care is easier now than it used to be. So we have this platform, we call it www.completecare.com, whereby you can speak to a doctor and you can organize for an appointment with a doctor, and you can be attended to at your comfortable time. And then diabetes is such a disease that requires multidisciplinary approach to care. With your family physician right by you, you can have a whole lot of success. So diabetes is a chronic, lifelong illness that requires screening, early diagnosis, medical care, patient self-management, education to prevent acute complications. Thank you so very much for joining in. Thank you for listening. Right now, we'll take a lot of questions. I'm handing over now to the moderator. Thank you.
Thank you so very much, Dr. Lagoju, for this very enlightening presentation, and for all our guests that have taken time to be with us on this webinar. We're very happy to have you. I want to tell you that you can hear more, know more about diabetes by going to our website, www.completecare.com. Remember that the complete starts with K. Also, you can consult doctor if you have diabetes, or if you want to hear more about diabetes, or if you want to clarify your fears about diabetes, or if you want to be consulted, or if you want to prevent diabetes. You can actually have a call, either a video or an audio call with our doctor, including Dr. Olagunju, who has just spoken to us. You can go to www.completecare.com and you can actually have that consultation with our doctor. So let me remind you that there's still much more you can discover and you can learn about this diabetes and other conditions by you registering on our website, www.completecare.com, with that K being the beginning of the complete. So we're now going to give opportunity for questions and comments. Already I can see that comments have started coming in. Let me thank one of our participants by name Bamidele for giving us a compliment there, saying this is a good presentation. Thank you so very much for your compliment. Also, we have questions that have started coming in. We have questions from Olaide Yongo. Thank you so much, Olaide Yongo. You asked the question, what of taking coffee? Does it have any effects on those who are diabetic? You need to understand, Olaide, that coffee has not been found to have negative effect on diabetics. However, coffee may not necessarily work well for everybody. There are people that react to the caffeine inside some caffeinated coffee. So you need to take coffee only if it is okay with you. Some people do have palpitations, some people do have dizziness when they take coffee. Some people may not sleep, and that may make them to have some giddiness or even to have dullness. You need to understand you are in that category and you are diabetic, you need to avoid coffee. But if you do not have such complaints, coffee is not contraindicated in diabetes. Also, Olushola Peters, we have seen your question. Thank you for being part of this webinar. Your question is for those who have family history of diabetes. What can they do to prevent diabetes? If you have family history of diabetes, what it means is that you have a higher risk of developing diabetes compared to those who do not have such family history. What then you need to do is you need to take primary prevention of diabetes very seriously. You need to do all that our speakers talked to us about. You need to exercise, make sure your body mass index is within normal. It should be between 18.9 to 24.9. Maintain your body mass index at that by doing exercise. You've been told about exercise. You should take about 10,000 steps a day, and you should eat appropriate food. Avoid junk and take a lot of fruits and water. Also, Aliyu Ibrahim, thank you for joining us in this webinar. You did ask the question, what does it mean to feel like vomiting during exercise? Well, you need to understand that some people that do rigorous exercise, especially if they are not trained athletes, can have initial response to rigorous exercise. They can have muscle aches, they can feel chest tightness, they can have chest pain, they can feel dizzy or giddy, or they can feel like vomiting. All those are signs that there are autonomic changes. Autonomic changes means that there are some of the nerves in their body that's responding to the exercise, producing some symptoms or even signs. When you feel that, what that simply means is that you need to stop the rigorous exercise, consult your doctor, because some people may have high blood pressure that has not been checked, and they do rigorous exercise, and that may make their blood pressure to go very high, and that can make them feel like vomiting, having a headache, or feeling dizzy. So if you have that, you need to see your doctor. Those are the questions that I've seen now. If there's any other question, yes, Dahila, you have just asked us. A friend is asking if diabetics is in any way linked to high blood pressure. That is actually correct. We call diabetes and high blood pressure husband and wife. Anywhere you see hypertension, is a matter of time the person may develop diabetes. Anywhere you see diabetes, is a matter of time the person may develop hypertension. So when you have high blood pressure, you actually need to be screened for diabetes. You may have pre-diabetes if you don't have overt diabetes. So for somebody that has high blood pressure, the person should go and check the blood sugar level. Joshua Onyilo, thank you for being with us on this platform. And you are asking, thanks for the type of platform. It is long overdue, although just coming on board. Yes, even though you came late, we're happy you are still able to join us. We do hope that in our next edition of webinar, you'll be able to join us on time. We do appreciate your being with us. Joshua Onyilo, thank you so much for your question. How regular will this be? It will be as regular as sometimes, perhaps at this beginning, once a month. And I want you to be our mouthpiece, telling people about it. And at most, it can be once in a quarter. But we will always keep you informed to let you know ahead of time anytime we're about to have a webinar. If there's any other question, we'll address it. Somebody is asking, the guests, your name is not here, what is the role of bitter leaf? Is there any benefit? Oh, that's one of the traditional things people do. They said diabetes means there's a lot of sugar. So for you to prevent a lot of sugar takes a lot of thing that is bitter. That is the origin of bitter leaf. But bitter leaf has not been found to be a medication for reducing blood sugar. However, bitter leaf is a leaf, and you have been told about taking a lot of vegetable. So it has benefits in providing other vitamins, roughages, and fibers, which are very helpful in food digestion and which can be beneficial to you living a healthy life. So that is the answer to your question, guest. Thank you for being with us. If there's any other question, we'll be very happy. Marian has asked the question, when do you start using insulin? You should not use insulin by yourself. It should not be bought over the counter. It should be only when a doctor prescribes it. Our speaker told us about type 1 and type 2 diabetes. In type 1 diabetes, our speaker told us that your pancreas is not producing insulin. And she used the example of the key. There's no key to open the door. When there's no key, that is, there's no insulin at all, or it's too low, that is type 1 diabetes. At that point, your doctor will prescribe insulin for you. Or in type 2 diabetes, at the very late stage, when the pancreas fails, it is overwhelmed and it can no longer produce insulin. At that stage, your doctor can prescribe insulin. But please, insulin can cause hypoglycemia, which can lead to death. Anybody that is using insulin should make sure they check their blood sugar regularly to prevent their blood sugar from being too low. That is the answer to your question. Marian, we appreciate your being with us on this webinar. Thank you. If there's any other question, we'll take it. We have just about 2 minutes to round up. But let me tell you before we round up that our audience today, we have opportunity to take survey, and you are going to be receiving a link for you to take survey to give us feedback. And also, you will have opportunity to have access to this webinar, which is going to be archived on our website, www.completecare.com. You will need to register as a member, and you will have access to our webinar that has been presented today. Marian, you are saying, should insulin be stored in the fridge? Yes, because insulin needs to be maintained at a particular temperature. So the doctor will tell you, the pharmacist will tell you that you should keep your insulin in the fridge. If there's any other question, in the next 1 minute or so, we will address that. But you can follow us on Facebook, you can follow us on LinkedIn, you can follow us on Twitter, and you can follow us on Instagram. The address is projected, and you can always follow us and know what we're doing. We're very grateful and we're happy for all our participants and listeners today. We do hope you'll be able to join us in our other subsequent edition of webinar. Thank you for being with us. We appreciate you. My name is Dr. Oluwagbenga Ogunfowokon, the moderator for this webinar. KompleteCare has brought this to you. Thank you for being with us. Goodbye.